It's an ethical labyrinth. The truth is, all high-income countries have done it. European countries have done it. The UK has done it. The US, Canada. They've all tried to advance purchase. And so, as Dr. Tedros, the head of the World Health Organization, said yesterday, this is one of the greatest moral failures that we've seen in recent years for the global community. In Israel's case, they're actually getting even more vaccines than places in Europe and the United States and other places. And the reason is they've struck a deal to actually exchange vaccine data in exchange for the vaccine itself. And so as they're rolling out their program, they're getting more vaccine and they're providing health information to Pfizer Corporation to help with its vaccine development. There's just no two ways about it. It is wrong. Um, it's one example of many inequities in the world. Dr. Tedros said yesterday, there are certain very low income countries that have 25 doses of the vaccine. That's not 25,000, it's not 25 million, it's 25. And we just heard on your broadcast that Europe is trying to vaccinate 70% of its population by the summer. The same is true with the United States and the UK. We're seeing an extremely unequal world. I've got an article out today in Foreign Affairs where we quote foreign ministers in Africa, and they call its COVID vaccines an apartheid because the rich have it, the poor don't, full stop. I mean, we have to give a pat on the back to WHO and also to the Gavi Alliance for Vaccines and CEPI that have really tried to put this COVAX facility together. They're still trying to provide vaccines by the end of the year, not immediately, to 20% of the population of low-income countries. Now, just think about that for a moment. We may not get that 20% even available, but would Europe accept 20% of its population vaccinated by the end of the year? With the US, no. Why should poorer countries do it? And even then, they may fail because the rich countries are hoarding the vaccines. It's basically a free-for-all. If you've got the influence, if you've got the money, if you've got the data, you get the vaccine. If you're poor, if you're marginalized, not to even mention prisoners, refugees, and others. We're really living in a very unjust world, and it should be tugging at our moral conscience.